As you begin feeling better, you will take increasing control over your own healthcare. Developing some routines will help establish habits that you will need to follow for the rest of your life.
Well, my family really helped me there. My sons and my daughter-in-laws came into town, and they set everything up with a notebook.
Every day you're supposed to be monitoring your own blood pressure.
Especially early on, the coordinators do a great job teaching the patients to record their vital signs several times a day, record blood sugars for those who are diabetic or might be diabetic, their weights, and their urine output.
Risk of rejection and infection is highest during the first 3 months. Because treatment is most effective when problems are quickly identified, be aware of how you are feeling and keep a daily record of your vital signs. Any type of infection can be more serious for transplant patients because infections can trigger rejection.
Patients are more susceptible to getting infection. If they take their anti-infective agents as directed, then that should cover them and prevent them from getting any kind of infection.
Because they're immunosuppressed, they're more susceptible to catching a cold or the flu.
When you get home, you will need to take care of your incision.
Most of the time, your incision will need no care. The stitches will usually be dissolvable, and on the outside there will either be glue or butterfly tapes.
Many patients recuperate without experiencing any serious complications, but be prepared to recognize potential emergencies. If you experience any dramatic changes in your health, contact your transplant team. If necessary, get to the nearest emergency room immediately.
For any life-threatening emergencies, whether shortness of breath, chest pain, anything where they feel a sense of impending danger, they should not wait to call us. They need to call 911.
Your first appointment will be with your surgeon 1 week after transplant. You will meet with your nephrologist within the first 2 weeks. It is essential to keep all appointments. Your team will closely monitor your recovery and make adjustments to your treatment. As your health improves, the number of appointments will decrease.
They'll spend the first maybe week or so kind of getting their sea legs and getting their energy and their appetite back, and then we'll see them in the office sometime during their first couple weeks.
And then what we usually do is have them follow up the next week with transplant nephrologists, and then we'll see them a couple weeks after that, a month after that, every 3 months after that, and then lifelong. I like to have the patients see us usually every 6 months to a year, but we like to partner with our other nephrologists who are referring doctors, especially for these people who come a long way away.
You know, I've never missed an appointment, never missed my labs, never missed a medication.
Your clinic visits are a good time to communicate with your physician about your progress. Write down any questions so you don't forget to ask them when you are meeting with your doctor.
So the first thing I try to do is ask them just simply, how do you feel? And usually most people say, I feel fine. Then usually people come up with, oh, well, you know, I'm not sleeping so well, I'm kind of jittery. They'll come up with the complaints, my feet are a little swollen, and then the concerns will come out. I really do want to know. I mean, this isn't just a routine question. I want to know so that we can help you.
Labs are really important because they indicate how your new kidney is working. At first, you will need to have blood drawn every week and then monthly for the rest of the year. Remember, it is your responsibility to call the transplant office with your vital signs the day of your tests.
Your kidney is a chemical laboratory in your body. It's regulating, monitoring all sorts of things. It's not just for generating urine.
People are very amazed sometimes, wow, that's a lot of blood work. Why do I need to get my blood done so much? But I can detect just about anything in their blood work.
You have no idea that you're having a rejection episode because this is a stealth problem. You don't know. It's not like you have a headache or a fever or anything. That's why it's so important to get those labs.
I then call my coordinator 2 days or 3 days after the blood test, and they give me the results of my blood test.
And based on that lab work and your levels, enzyme levels and the immune system, they regulate how much of these medications to take, which normally they begin reducing them.
Doing the blood work, which is very important, they can monitor you without seeing you.
But then after a while, you learn no news is good news, and that no news means that you're tracking normally.
Make sure that you take all your medications on schedule. This lesson is simple. Take your medicine correctly. Your life depends on it.
Medications, usually the doses start out fairly high and there's a fair number of pills to take in the beginning after the transplant, but shortly thereafter the doses and the numbers of pills get tapered.
My concern was what I could do to avoid rejection, so that was taking the anti-rejection pills, and they load you up a lot with pills at the maximum dosage, and then they wean you as time goes.
So it's really important that patients understand how to take their medications and take them exactly as prescribed.
Take them 8:30 a.m. and 8:30 p.m.
I took it at 7:30 at night and 7:30 in the morning.
Wherever I am, 8:30 comes around, not 8:31 and not 8:29 or whatever. It's 8:30.
You know, I would rather take medication every day than have to live on dialysis.
The problems that may arise if they forget to take their medications, they can develop rejection and potentially lose their transplanted organ.
Because they told me that the greatest cause of rejection was people not taking the medication, which I think is insane.
You also get into a problem then, I feel great, I feel back to normal. People stop taking it or they don't take it every day.
I think it's kind of like breathing. You do it every day, and after a while, you don't think about it, you just do it.
You are tricking your body into accepting a new kidney. Anti-rejection meds suppress your immune system, keeping your body from attacking the new organ. Because your immune system is depressed, you will need anti-infective medicines and to avoid unhealthy situations.
If I see someone coughing or having a cold or anything like that, I steer clear of them. I don't want to be near anyone where there's a possibility of my becoming ill because of them.
You have to wash your hands a lot. I didn't want to get any infections, and I didn't get any infections.
I mean, obviously I avoid people who have coughs and colds and things like this, and I carry little Germ-X with me.
The food's been sitting out for more than an hour and it's something that should be refrigerated. The transplant patients should stay away from it.
They said, if this could cause a rejection, I can give up the buffets.
Creating a system to organize your doses will keep you on schedule.
I had my nice pill box like an 80-year-old woman where I had, my 15 pills in it that I took every day.
When I left the hospital, the first thing I did is I got a pill box so that I could separate the pills so that I wouldn't get confused, and I followed the instructions to the T.
Some of the medications do have side effects, but again, knowing what to expect and how to counteract some of the effects will help.
First couple of days, I think patients are feeling pretty good. Then they start to feel the side effects. And the major side effects you're probably going to notice early on are going to be things like a little shaky, little jitters, maybe a little trouble falling asleep, staying asleep. Can be some mood changes, and usually these are related to medicines that go away as we lower the medicines over time.
The most important thing for the patients to remember is that if they do experience a side effect, that they contact their transplant coordinator or they contact their physician, and they do not stop taking their immunosuppressive therapy without first consulting somebody.
Communicate any drug reactions to your team. They may be able to help.
We do transplant 24 hours a day, 7 days a week, 365 days a year. This is what we're experts at. We don't expect your doctors to know all the interactions with the drugs or everything. We don't expect you to know that. So if you see something on TV, a new medicine you want to try, or your doctor wants to prescribe a medicine for you, your doctor prescribes a medicine, take it, but give us a call.
It's an amazing feeling to know that it's a phone call away. They're on my speed dial.
We also can provide them with a list of over-the-counter medications that are safe for them to take when they go home, so there isn't any question about it.
It's your body, it's your personal responsibility. You have to look out for yourself, and we're happy to help you.
Your medications will be expensive. If you have financial concerns, let your social worker know.
If a patient is having financial difficulty obtaining their medications, it's really important to let the outpatient social worker know that as soon as possible.
Financial problems can happen at any time in someone's life. Now that you have a transplant and you have to take medicines and maintain a certain level of care to maintain your transplant, those things become a little more important.
Some patients are eligible to receive funding through the Missouri Kidney Program. Other patients can apply directly to the manufacturers of that drug company and get some assistance that way. And the social worker can really help the patient sort through all those kinds of issues.
There's plenty of resources out there, and don't feel alone. We're here to help you.